Good afternoon, everyone, and welcome to today's press conference. It's hosted by the Minister of Health, the Honorable Ken Wilson, who is joined by the Acting Minister of Education, the Honorable Tinee Furbert, and we are also joined by Dr. Wesley Miller of the Bermuda Hospitals Board. We will start today's press conference with remarks by the Minister of Health. Minister?
Thank you, honey, and good afternoon, everyone. Today, I'm pleased to be able to announce that following consultation with our stakeholders, including Public Health England, amendments to the Quarantine COVID-19 No. 3 Order 2020 will be made effective from the 20th of January 2022. And these changes will further streamline our quarantine and testing guidelines. The current requirements for non-immunized persons who must quarantine or isolate is for a period of 14 days, and that they must book and get a verified PCR test to test out of quarantine or isolation. This requirement will change as they must now quarantine or isolate for only 10 days and be able to test out with a verified antigen test on day 10. If you are immunized and required to quarantine or isolate as a close contact, again, the current requirements is for a period of 10 days and testing out with a verified PCR test on day 10. And the changes that will take effect at the end of the 20th of January, will be that 10 days will now be reduced to 7 days, and they'll be able to test out with a verified antigen test. If you are immunized and boosted within 6 months, you currently must quarantine for 10 days and again test out with a verified PCR test. This requirement will change and no quarantine will be required. However, a verified antigen test will be required on day 7, and it will also be recommended that daily antigen tests are taken for self-monitoring during that 7-day period. The current requirement of 5 days for a verified antigen test for immunized persons who require quarantine or isolation for repatriation to the United States is also going to change. Persons will be repatriated according to their country's repatriation requirements. This requirement may be between 5 or 10 days quarantine with a verified antigen or PCR test. And again, it is subject to the requirements for repatriation for Canada, America, or the United Kingdom. Currently, returning residents and visitors conduct a pre-test, a test on arrival, and another test on day 4 and day 10 using a PCR. This requirement will also change, and those traveling to Bermuda will conduct a pre-test, test on arrival, and test on day 4 using a verified antigen test. No longer will a day 10 test be required. Regardless of your quarantine and isolation requirements, everyone should follow the public health guidance, avoid closed spaces, crowded places, and close contact settings. Wear a mask indoors and outdoors if you cannot physically distance, practice good hand hygiene, maintain physical distancing, and download the We Health Bermuda app. As well, those recently removed from quarantine or isolation should continue to monitor their health symptoms. With respect to antigen tests, there are many fake antigen tests on the market. So the Department of Health will continue to oversee and protect importers from counterfeit goods in collaboration with HM Customs. A complete list of the approved antigen tests can be found on the Bermuda Health Council website at bhec.bm/approved antigen test. The listed tests have met the required standards for validation, which are set out in the protocols of the identified regulatory bodies. These kits display performance characteristics that are desirable for mass population, community-based testing here in Bermuda. The desirable performance characteristics include very high specificity and very high sensitivity against viral loads associated with the infectiousness and robust product review. SARS-CoV-2 antigen test kits that are not explicitly on the above list that I've referred to are not allowed to be sold within or imported into Bermuda for screening against SARS-CoV-2 in any setting. The amendments to the Quarantine COVID-19 No. 3 Order 2020 referred to above will again take effect from the 20th of January 2022. On another note, Anyone that is traveling to Bermuda should review the entry requirements. Travelers leaving Bermuda should also carefully review the inbound travel guidance of their destination for information on entry testing requirements. Bermuda's COVID travel information can be found on coronavirus.gov.bm. Bermuda, we are trying to get back to some semblance of normalcy, and as we learn to live and cope with COVID-19. And these changes to testing and quarantining are a welcome transition for Bermuda and pivotal to our progress. These changes will also allow for persons to return to their employment sooner so that the economy and essential service workers can provide the necessary services required to keep Bermuda moving. I am certain that these changes will be welcomed by employers and employees alike. But please remember, reducing requirements does not mean that we are risk-free. We need to continue to protect ourselves. We are all accountable for the health and safety of this community, and I encourage everyone to be extra vigilant and to take personal responsibility for their health and safety. Do not go to work, events, school, or any outings if you have symptoms or you are positive and asymptomatic. This is how the virus continues to spread. In closing, as of January 15th, 2022, we will be able to update our vaccination records to include booster information for persons that received their boosters overseas. Those persons who have already received Bermuda government vaccination certificates can have their overseas boosters included as long as they can provide the following information: the proof of the booster dose, a valid ID, and a Bermuda passport or driver's license will suffice, proof of travel during the time that the booster was administered. All submissions must be emailed to the following address: vaccines@gov.bm. Furthermore, as was previously announced, that anyone who is immunized and whose second dose is older than 6 months will require a booster to receive their renewed safe key, and that was meant to commence on the 15th of January, 2022. However, as we had limited vaccine centers open over the holiday, as well as a delay with the testing results, this deadline has been extended to February 15th to allow more time for those who wish to get their booster and be eligible for the automatic monthly renewal of their safe key. So anyone who is immunized and whose second dose is older than 6 months will require a booster to receive a renewed safe key starting from the 15th of February 2022. Another bit of good news for our arriving passengers: we will also soon begin antigen and PCR testing upon arrival at the airport for faster arrival test results. We do not have an exact date for this. However, we are working through the logistics, and I can assure the public that further details will be made available when we have those details. Bermuda, please remember that our way forward depends a lot on our own collective responsibility. Each of us has a vital role to play. And as I had said earlier, everyone should continue to follow the public health guidance. Avoid closed spaces, crowded places, and close contact settings. Wear a mask indoors and outdoors if you cannot physically distance. Practice good hand hygiene, maintain physical distance, and download the We Health Bermuda app. Later today, we will also be releasing our latest coronavirus and vaccine status, so stay tuned. I'd like to now turn over to the Acting Minister of Education, the Honorable Minister Tinee Furbert. Thank you.
Good afternoon, members of the media and the Bermuda public. Thank you, Minister of Health, for your update. The last wave of the coronavirus has again disrupted our day-to-day activities. I can say firsthand as a parent, getting my child back to school has not been the easiest of processes. We have had to consider testing regimes, remote learning, and in some cases, the challenges of being in quarantine. This current spike has not made engaging in learning the most manageable situation for any parent. Let me begin by expressing my thanks to all the parents and guardians who have been troopers as we have had to navigate the many testing protocols and processes to get our children back to school. I want to express sincere gratitude to the teachers, staff, and principals who have been working with the Ministry of Education to find the best way forward for our young people and are demonstrating willingness to exceed ordinary efforts. Collaboration is vital, and I'm satisfied that we have had the best interest of our children at the forefront of every decision. I look forward to continuing the collaboration efforts in this regard. It is no secret, however, that we have also come under fierce criticism born out of extreme disappointment and inconvenience. But my hope as we move forward is that we can all pull together to win together, because notwithstanding the challenges, failure is really not an option. Yet moving forward should also mean acknowledging the past and the present. An unprecedented level of demand for PCR COVID-19 tests and subsequent delays in processing results put us all under a difficult position. We were forced to stagger the reopening of schools, and this was not ideal for many of our parents and guardians, and it certainly was not the best outcome for some of our students. Staff members were, of course, also inconvenienced, and many had to retest when that 3-day window expired. The ministry and department have been fielding many questions, criticisms, and suggestions. Parents and guardians have asked questions such as, why did we not have a backup plan? Why was so little notice given when schools were cleared to open? How can you ensure a safe environment if the saliva testing program is being paused? These are reasonable questions, and I can assure you that our ability to plan and adapt under these circumstances will be reviewed. I can also assure you that the staff at the department and the ministry have performed human service, responding to the multiple and sometimes conflicting demands at a moment's notice. Tough decisions have had to be made and will continue to be made as we move into the future. Some will disagree with these decisions. What won't change is our overriding priority to ensure safe in-school learning for our students. We may not have always agreed, but we have always had the best interests of our children at the forefront of every decision. And I look forward to continuing the collaborative efforts again in this regard. I am pleased to say that this morning I held a meeting with the Education Emergency Measures Committee and shared a number of ministry updates. These included a change in the COVID pre-return school testing policy, an update on the retesting of our students, information about the at-home antigen pilot test that will be launched this weekend, and the school saliva screening program. Let me first share that about the change in the policy. Previously, it was mandatory that all staff and students in public schools produce a negative PCR test result before entering school buildings after school midterm break. This requirement was introduced to protect the health and safety of students and staff as a necessary measure to prevent and reduce bringing COVID-19 into school buildings upon reopening. The policy will now be that all staff and students must produce a certified negative antigen test result before entering school buildings after a school break. This will ensure that results are received in a sufficient time to support in-person learning. Due to the delay in students receiving their pre-return PCR test in January, many had to retest to return to the school buildings. We are thankful to the health and MDL team for collaborating with the ministry this week to schedule retesting of students. On Monday this week, preschool students were retested. Just yesterday and today, our primary school students are being retested. And this morning, we were informed that our middle school students will be retested next week, Monday. Parents of middle school students will need to book an appointment to have their children retested. This information will be sent directly to parents from their respective school principals. Following the advice of the Ministry of Health and engagement with school staff and parents, the ministry will be rolling out a at-home antigen testing for all public schools. While there are pros and cons, that at-home antigen testing is faster, more efficient, and can be done in the privacy of one's home, it also provides immediate results and eliminates disruptions to teaching and learning schedules in school. Staff and students of selected pilot schools will start testing this Sunday evening, with all other schools starting later next week. Due to a generous donation, antigen tests are being provided free of charge. Parents of pilot schools have received information on the testing program, and information will be shared early next week with the staff and parents of all other schools. There have been several questions regarding the weekly school saliva screening testing program. This program has been placed on pause. However, the ministry is cognizant of the rise in numbers of positive COVID cases and the importance of keeping our schools safe for students and school staff. Therefore, in addition to the antigen testing pilot that will commence this weekend, the remainder of our schools will be provided with at-home antigen tests commencing next week, Monday, so that all students participate in weekly antigen testing commencing on Wednesday. The Ministry of Education is happy to acknowledge that we are making progress. However, we urge parents and guardians to continue to work with us by sharing your questions with school staff, administrators, and leaders, which will assist with understanding. With the at-home antigen test program, we ask for your honest word in providing the correct test results. It is imperative that all the instructions are followed correctly and that parents, guardians report the results before a student returns to school. Ultimately, however, success will depend on the actions of each individual parent. The at-home antigen testing relies entirely on accurate reporting of results by parents. Support and cooperation of all parents and staff will help keep schools safer for students, staff, and families. This includes regular, accurate reporting of at-home antigen testing results and staying home following a positive test result. I implore all parents, guardians, school staff, and all of our students, let us pull together to win together. If there are questions or concerns, please contact the COVID unit at COVID-19 unit at moed.bm. Thank you, and please be safe, Bermuda.
Thank you, Minister Furbert. We now invite Dr. Miller to please say a few words.
Thank you very much. Certainly must start off by thanking the Minister of Health and the Ministry of Health, the Bermuda Public, and certainly the staff here at BHB for their preparedness and the energy to deal with yet another wave of the COVID pandemic. And as we see a rise taking place, it's also important to note the changes as we adjust to live with COVID and at the same time try to keep the various groups within our society safe. Here at the hospital, we have had challenges in the past and we have some now, but we also have solutions. You would have seen in the papers that we have a significant number of staff off because of COVID exposure. However, we're still able to operate the routine clinical services and the specialist services. We have made plans, as we did the last time, to deal with any further surge resulting in bed occupancy or the filling up of the intensive care unit. As it stands now, the intensive care unit has beds available and we are ready and prepared. But in addition to that, we had satellite units that were created on the previous occasion, and those are ready to go if and when needed. And we do anticipate that we probably will So we have the plans in place and certainly the structures are in place. So it's just a matter of dusting off those plans and moving again. Staffing will remain a concern as it was on the previous occasion, probably more so this time because of the infectious nature of the Omicron variant. Also, we recognize that there isn't any place else that we're going to be able to get staff from in a hurry because everywhere else, the United States, Canada, the UK and elsewhere, they are also scrambling for staff as they find that some of their staff go off ill and we have to ask people to work overtime or reposition the way we do things. We have had a backlog of some elective procedures from the previous waves. And so what we did throughout December, November and December, we ramped up the numbers as much as we possibly could. We have a particular challenge every January, oftentimes going into February, where because at that time of the year, we tend to see more admissions, some due to the flu, some to other things. We have a challenge in terms of the current bed occupancy, and where we would seek assistance of the public is by asking that those who have relatives in the hospital that can possibly go home, if you were to come to collect those relatives, you would help greatly in terms of us being able to have bed space freed up so that we can treat more elective patients. It would also help us in terms of the delay that we sometimes have in the emergency department where people come and they get seen, we plan to admit them, but then they have to wait for a bed to become available. So help from the public in collecting their relatives would be greatly appreciated. In terms of visitation, we understand the importance of being able to visit your loved ones in hospital. And so we have made that as easy as possible. Obviously, we have two particular areas within the long term where we have had to introduce special measures and therefore there's some restriction on visitation. But in the other areas, we are operating as normal as it is safe to operate. So one message to the public I would ask is that if you're feeling ill, if you consider that it may be something serious, do not stay away. The hospital is open for business. The emergency department will see you and we will treat as necessary. If you have symptoms that you believe are due to COVID or they have been, if you don't have the testing or you can't get the information elsewhere, BHB will be there to help. We have had to temporarily adjust the hours at the urgent care center due to a bit of staffing shortage so as to make sure that we can continue to offer full service at the emergency department at the King Edward site. However, there are still some service that we have at the urgent care center. And the plan is as soon as things ease so that we have adequate staff, we will revert to normal hours at the urgent care center. There's no plan to close it. And I would like to end by saying to others that we recognize the challenges in testing, and so BHB has also made the efforts, and in fact we have the plans in place now and have actually started to do more testing within the hospital, and we are thankful to the ministry for the understanding and the cooperation that make that possible. So in terms of people coming in and worrying if they will catch COVID in VHB, the chance of that happening at this time is very, very small, and you should not let that be a consideration in keeping your way in the event of any significant illness or problem. Thank you very much.
Thank you, Dr. Miller, and thank you both to the ministers. We will now take questions from the media, and we'll start with Mr. Gary Foster Skelton of the Bermuda Broadcasting Company. Gary.
Good afternoon.
Good afternoon, Gary. We can see you and hear you. Thank you.
Thank you. Now I can see everyone. Thank you. So good afternoon, ministers, and thank you for speaking to us. Just before I ask my first question, could I request a quick clarification from Minister Wilson? The changes to quarantine and testing, when you said if you are immunized and boosted within 6 months, you currently must quarantine for 10 days and test out with a verified PCR test. This requirement will change and no quarantine will be required. Who does that refer to?
That would refer to persons that are close contacts that are boosted.
Thank you. Just wanted to clarify that. Thank you, Minister. Now, my first question, the latest test results released by your ministry on Monday were from testing done last Thursday, exactly 1 week ago, with a positivity rate of roughly 10%. Back then. Case numbers could be spiraling daily, but for the past week, the public has had no idea how many active cases there are. Would you agree that this delay is both unacceptable and potentially dangerous?
Actually, I wouldn't agree with that, Gary. We are seeing, as similar as what we saw with respect to Delta, a huge increase in testing. For the month of December leading up to just a couple weeks ago, actually less than a couple of weeks ago, we had basically a perfect storm. We saw an increase in testing capacity requirements with respect to returning to school. We saw an increase of testing capacity requirements because of so much travel over the holiday. And we also saw an increase of the requirements for the antigen testing as a result of the Biden administration's 24-hour requirement to enter the United States. So no, I wouldn't agree with that. We do appreciate that the positivity rate has increased. That is a element of Omicron, and we recognize it's so highly transmissible. It is anticipated that it will continue to be high numbers of positivity until the virus has taken its toll and starts to die out, so to speak, as you're seeing in certain jurisdictions, like in New York, for example.
We understand rapid antigen testing has or will replace PCR testing for staff at nursing homes. How can you justify this change in light of the fact that PCR remains the gold standard, by your words, and people in nursing homes are among the most vulnerable members of our society? Are you compromising the safety of seniors to save money?
No, not at all. Particularly as it relates to this Omicron variant, and what we're finding is, I'll yield to Dr. Miller in a minute, but what we're finding with respect to the testing protocols that are being adopted in nursing homes is that the requirement will be for them to be tested on a regular basis, the staff as well as the residents, and they will continue to do the other public health measures such as monitoring their health, and likewise. The rest homes are, I believe, in phase 3, which has more restrictions insofar as visitations and so forth. So, for example, persons that wish to visit their loved ones must have an antigen test prior to the visit and or a safe key. So there are enhanced measures that have already been adopted within the nursing homes to best protect and preserve the safety and well-being, not only of the residents, but also of the vulnerable populations that are living in those rest homes.
The staff themselves will not be having the gold standard of testing to ensure they're not accidentally bringing the virus to those vulnerable residents. Is that correct?
The staff themselves will continue the antigen testing. And what we're finding is that the antigen testing conducted regularly will provide a measure of control so that persons can see and identify what the circumstances are with respect to persons being infectious.
Okay.
Dr.
Well,
Miller, did you want to add to that insofar as the use of the antigen testing?
Yes, I'd certainly like to, Minister. What happens, Gary, is that I understand your question because one has to consider any sort of test in a particular context. And what has been shown in several works in the UK and elsewhere, whenever the incidence of COVID is high in any particular society or any group, the accuracy of the antigen testing is such that it matches the accuracy of the PCR to the extent that you don't have to say, keep somebody away and rely on having a PCR test. And that is why it is so widely used in the UK and widely used elsewhere. One of the challenges that we have is like in so many things, you have to carefully choose and regulate which ones, because people will bring fake tests on the market or knockoffs. And that was one of the considerations that they had in the UK. We've had that consideration here in various parts of the states to make sure that you only use those that are validated. And that's why the ministry will have a list of approved tests, kits, and some will not be on it.
So to just clarify your answer, are you saying at this time, with high numbers in the community, rapid antigen testing is as reliable as the gold standard saliva testing or PCR saliva testing, PCR nasal pharyngeal testing?
Yes, and when the incidence is high, it is just as reliable. When the incidence fall, then it's different.
Okay.
And that is why you can use it in that situation. And if you look at the UK, that's also why Public Health England and the various other bodies recommend it.
Okay. As of yesterday, we had 150 BHP staff off due to COVID protocols. Firefighters say they don't have enough personnel to cover the island, and close to 50 police officers are out of action. That's not to mention all the employees in government and the private sector who are off work. All this amid rapidly rising fifth wave infections. And to some, this may look like a national emergency, and yet you have chosen this moment to reduce quarantine requirements and switch from PCR tests to antigen tests, which you say in this circumstance are just as good. But are these decisions based on public pressure, political expediency, economic necessity? And if so, is public health taking a back seat?
Gary, I don't know if it's directed to me or the minister, but if you were to permit me, I would be happy to answer that.
Please, yourself and the minister, I would like to hear your thoughts on that.
What happens is that whenever we look at changes in regulation in any small jurisdiction, you have to compare it to what the evidence from bigger jurisdictions show, because we don't have the population numbers, we don't have the research facilities, we don't have all the technical things. So hence we have to be guided by the bigger bodies that have a whole range of data and research people. And so we look to Public Health England, and we also keep an eye on the recommendations from the CDC, so that whereas we would not necessarily be bounded by everything that they do. In terms of scientific guidance, we have to bear in mind, just like in the way we treat anything else, we would be looking to the journals, the big centers, to see what they do and take that into serious consideration as we make any move. So if you were to look at the UK, for instance, the UK has moved their quarantine period, even in the face of Omicron, they have moved their quarantine period down from 14 days to 10 days, and now they're at 7 days. And they do that based on the data that they have. The CDC has recommended that for certain categories, it should be 5 days. Well, we like to be a bit more conservative by nature, and therefore we think, okay, the Public Health England is probably the one to hang our hat on because it's the more conservative of the two. But these on the Western side have more data than anywhere else. If it was that there was better data from France or Germany, of course we'd be happy to use that. And whenever data comes from any other big place, we'd use it. We don't have data from China that we could rely on, but we know the quality of data from the CDC and the quality of the data from Public Health England. So one has to be informed by the data, and then the considerations will then be made reflecting that data.
Thank you, Dr. Miller. And Garrett, if I could just add to that, you have to also recognize that we do need to take steps to live with COVID. We have over 70% of our population are already immunized, and over 50% of that number have received their boosters. So we are in a far greater position than we were a year ago. And certainly employers will no doubt welcome the news as it relates to the reduction of time a person needs to quarantine and isolate. And examples that you quite rightly cited with respect to the Bermuda Fire Service and the like, there are agencies and organizations that are suffering as a result of persons being on quarantine. And I'm certain that this will be welcome news, recognizing what other international bodies, as Dr. Miller adequately mentioned, are doing. So we're seeing, and this is principally based on the science and the evidence that we're seeing as it relates to the Omicron variant and the transmission and you know, all of that data that Dr. Miller just referred to. So the reality is we are certainly conscious of all that information, but we're also conscious of the economic impact and allowing persons to quarantine and isolate for less periods of time and to get on with going to work.
Okay. But with all that personnel off work, could that create a national emergency if with all these people who are off work at this time?
Well, Dr. Miller has adequately spoken about the issues as it relates to BHP. As it relates to the fire service, I'd invite you to speak to the substantive minister about that, and she would no doubt be able to provide any information as to what the challenges may or may not exist. But I think the important message is that from the 20th of January, a person, for example, who's been boosted within 6 months, who would have had to was a close contact, who would have ordinarily had to be required to quarantine at home for 10 days, now does not need to quarantine. And they opt out at day 7 and take an antigen test. Those are just illustrations of what the benefit will be with these potential quarantine and isolation rules that will change and come in effect on the 20th of January, which in essence, people do not need to be off work for as long as a period of time as previously.
Now, if someone tests positive on an antigen test and decides not to follow through with a PCR test or inform their GP, government has no record of that infection. Is it likely that the actual number of active cases in Bermuda is considerably higher than the official figures suggest?
Well, just like in other jurisdictions, we're seeing that the figures that are reported are probably not as high because people are doing at-home antigen testing, which we're encouraging. We are encouraging personal responsibility. And if persons test at home, and I've known of a number of cases, and I applaud these individuals who go into the pharmacy or wherever, pick up their antigen test because they feel symptomatic. They take the test, they're positive, and they do what they know they're supposed to do, which is isolate from their family, don't go into work, et cetera. So our numbers probably would be higher, but that's in every other jurisdiction because people are relying on the antigen test. But we're encouraging that. That's why the government allowed for the importation of antigen testing so that people could take personal responsibility for their health and knowledge of whether or not they are positive. So our numbers could very well, or more likely than not, to be higher than what they are because people are taking the antigen testing. It's not reportable and they're doing what they're supposed to do, which is to isolate.
Now, Minister, in an interview with Bermuda Broadcasting yesterday, you did say that relying wholly on government for COVID testing is not sustainable, and you encourage people to take personal responsibility and acquire rapid tests to monitor their COVID status. You also said we have to learn to live with COVID, which you've just repeated again. While Omicron does not appear to be as individually harmful as Delta, we are experiencing our fastest growing outbreak, and the sheer number of infections could still put health services under tremendous pressure. Can you see how some people might find it disturbing that at a time when cases are spiraling, government is essentially loosening protocols? What would you say to them who think that you are going in the wrong direction?
I would say that in addition to what Dr. Miller said with respect to the scientific evidence that's supporting the decisions that we are making based out of Public Health England as well as CDC, it's important to note that these are considerations that are not made lightly, and we do have to base it on the consultation and the information that we're receiving from other international agencies such as CDC and Public Health England. Unlike those jurisdictions, in Bermuda, in order to, notwithstanding that we are shortening the period of quarantine, Gary, as well as the period of isolation, and instead of a PCR, you're doing an antigen test, unlike those jurisdictions, you still need to test out. So we have that other matter that is not a measure that is not applicable in the United States or the United Kingdom. So before you leave your quarantine or isolation, you must test out.
And my final question, I do want to take that term, personal responsibility has been government's mantra since the last outbreak. But after the third wave of infections last March and subsequent quarantine and public health violations, it seems apparent that government's legislation has not been able to swiftly and sternly deal with those whose irresponsibility has had devastating impacts. I'm not referring to general curfew tickets, but to quarantine and public health violations that we know resulted in virus outbreaks. If your legislation can't deal swiftly and sternly with the willfully irresponsible, isn't your mantra of personal responsibility simply government saying it's not our problem anymore?
Absolutely not. Absolutely not. It's very difficult to legislate good behavior. The reality is that in all forms of legislation, there is going to be an element of personal responsibility. Speeding, the police are not out. I'm just using that as an example. You can't see the police, because of their other vast responsibilities, are not out on every single road, every single corner to catch speeders. The law says you cannot go over 35 kilometers an hour. People speed. That's an issue where a person has directly decided that they're not going to participate in the legal requirements to adhere to the speed.
But there are specific consequences.
Absolutely,
which could
just
result
like
in you losing your license.
And there's also consequences for people breaching quarantine and the like. And we've seen people in court, and we've seen fines issued and penalties issued. So that does still exist. But at the end of the day, when you're dealing with a national pandemic that will be with us for quite some time, we need to ensure that people are each other's keepers and people take personal responsibility for their own welfare. We've offered the vaccination. Over 70% of our population have been immunized. 50% of that have been boosted. Government is doing what they can to assist and facilitate that, but there is a degree of personal responsibility that is required for everyone so that we can get through this.
Minister, thank you. Thank you, Minister. Thank you, Dr. Miller. Thank you,
Thank you, Gary. Thank you very much.
Thank you very much.
We'll now take questions from Sean Connolly of the Royal Gazette. Sean, your volume is quite low and we do not. And you need to turn down the volume on your device as well. Thanks.
Yeah.
Sean?
Yeah, hi. Yeah. Can you hear me?
Yes, we can hear you. Would you like to go ahead and ask questions?
Okay. Yes. Good afternoon, ministers and Dr. Miller. Minister, this question is directed to the two ministers, essentially. Minister Furbert referenced the huge wave of criticism and anger that has been directed at the government's handling of the situation in the last 2 weeks. With so many ministers being out of the country at the same time, including the Premier, and the warnings from Dr. Weldon that the testing system would be overwhelmed if you pressed ahead with the failed plans in the end to open schools on January 5th, and the constant delays in results. Do you accept that the government lost its grip on the situation?
No, Sean, I wouldn't accept that at all. In fact, you would have heard the Premier recently indicate that notwithstanding certain members of the cabinet were on holiday, we fortunately are equipped with a number of persons that are able to act in the absence of persons that are abroad. And so we do certainly have acting ministers that have fulfilled the responsibilities needed to address the issues of the cabinet. One of the acting ministers who has done a stellar job in doing that is joined with me in today's press conference. So the issue as it results, as you indicated, is whether or not government's lost its grip. I certainly wouldn't support that. Leading is very challenging in the best of days, not least of which when you're dealing with a national pandemic. And the reality is, again, persons, if holidays are taken, there are persons that are suitably qualified that sit in the cabinet and know the direction of travel and the intent and the policy direction of the government, because they meet every Tuesday with respect to that. And fortunately, we live in a world where internet, Wi-Fi, and everything else is at everyone's disposal. So unless you're on the moon, it's not difficult to be able to keep in contact with our colleagues.
Why did it go wrong so quickly then? Why did it go wrong so quickly then, the situation?
I'm not sure what you're referring to as going wrong.
The delays in testing specifically.
Pardon me?
The delays in testing.
As I indicated previously, in December, we had what I would refer to as a perfect storm. We had the convergence of persons there were higher numbers of persons traveling over the Christmas holiday. We had the testing requirements for the return to school, and we also had to facilitate the Biden administration's requirements for 24-hour turnaround with respect to antigen. So all of those together collectively in the midst of a highly transmissible variant of Omicron added to the further stress on our testing systems. Moving forward from the announcements that we've just mentioned, not only will it allow for persons to return to work who are in quarantine or isolation sooner, but it will also remove some of the strain on the requirement of PCR testing, because we will be substituting it with antigen testing, as I just spoke about.
Dr. Karika Weldon said that she warned officials, civil servants, on 4 different occasions that if you pressed on with your, in the end, failed attempts to open all the schools on January 5th, that level of testing would overwhelm the system. So was that information passed on to ministers and the Premier from Dr. Weldon, and why was it ignored?
The information, I'm not, you'll have to speak to Dr. Weldon specifically about whom or what she's referring to about passed on, but what I can say is that as the Premier indicated the other day, it's not a matter of ignoring it, but as a government, we have a huge responsibility to consider a number of factors as it relates to the governance of this country. One of them, which eloquently was recently spoken about by the acting Minister of Education, which we all can adhere to, is the need for children to be in school learning. And notwithstanding a difference of opinion, as the Premier stated, with respect to a desire not to allow for in-school learning or to reduce the testing capacity because of that, parents, I'm certain, are thrilled that school is returning so that their children can be in school learning, because we recognize socially and academically and educationally that is in the best welfare of the children.
All the things you cited, such as the Christmas travel rush, the plan to test pupils and teachers, they were all very predictable, and as you'd accept. And Dr. Weldon said that she told government officials on 4 occasions that the system would be overwhelmed, which it was, if you pressed ahead with the failed bid to reopen all schools on January the 5th. So isn't it clear that Dr. Weldon got it right and the government got it wrong on that?
Again, Sean, I'm not suggesting that somebody got it right or somebody got it wrong, but the priority of the government was to take steps to ensure that students could return to in-school learning, so that would allow for the reasons that I've just spoken about. It would not interfere adversely with parents not being able to find suitable accommodations for their children and them missing work and so forth. So there would have been a natural knock-on effect.
Dr. Weldon is now, after her fears were ignored, she's now announced that she's resigning at the end of the month. She's the top scientist. On a scale of 1 to 10, 10 being very bad, what kind of adverse impact do you think her departure will have on the island's fight against COVID going forward?
Actually, I don't believe it'll have any impact at all, certainly on that. Fortunately, Dr. Weldon has assisted tremendously in training other persons that work within the MDL. We have other private laboratories who we have relied on previously. You may recall that when we first started testing in Bermuda, we had to send all of our testing overseas for testing, and one of the private labs in Bermuda, Helix, stepped up to the plate and assisted us with establishing on-island testing facilities here. We have sufficient resources here in Bermuda, and notwithstanding the tremendous impact that Dr. Weldon has provided to the services of Bermuda, MDL will continue to run, and I don't anticipate any adverse impact in her departure with respect to our continuation of testing in Bermuda.
You don't think losing the island's top anti-COVID scientist is going to have any kind of effect on the system adversely?
Do you mind repeating that? I'm sorry, you dropped.
You're saying that losing the island's top, effectively the top anti-COVID scientist from the fight back against COVID, that's not going to have any impact at all?
I'm not sure what you mean by anti-COVID scientists, because we have quite a number of other scientists and doctors and physicians and medical practitioners that have been intimately involved in our fight against COVID. But as I indicated previously, the lab will continue its operations, and I don't anticipate, you asked me what on a scale of 1 to 10, 10 being impactful, I would say 1. I do not anticipate there will be any missteps or any impact by Dr. Weldon's departure, because the lab will continue to run and perform the duties that they have been set up and established to do.
Is Dr. Weldon going to be replaced, and do you have somebody in mind for that role?
The MDL lab actually comes under the Cabinet Office, so I'd invite you to direct those inquiries there if you actually want some answers.
But you're health minister, so
I am the health minister.
Do you have an opinion on this or a view?
I am the health minister, and I would invite you to direct those inquiries to the Cabinet Office, who are charged with overseeing the MDL. They do work in conjunction with health, but I'd invite you to direct those questions there.
As Gary mentioned, 50 police officers have been struck down by this, and there was no effective fire service on the island for a period yesterday. You keep talking, or ministers keep talking about contingency plans. Specifically, what are those contingency plans, and why haven't they been put in place yet?
Sean, I'm not sure what you're referring to about ministers referring to contingency plans, but I would invite you to speak to the Minister of National Security, to whom the remit of fire and police falls. She'll be better suited to provide you with any answers as it relates to the contingency plans. However, as I stated previously with Gary, the announcements that we've just made that will be operational from the 20th of January will allow a large group of individuals who are either in isolation and or quarantine to return to work sooner, given the amendments that will be made to the quarantine order.
You've suddenly slashed the quarantine timeframe, as you've said. Opposition figures have called for the safe key and other safety regulations to go next week. Why don't you do that as well?
We as a cabinet constantly review our policies and our procedures as well as it relates specifically to COVID and the measures that are being adopted by a cabinet, and we continue to have those discussions. The Cabinet Subcommittee on COVID meets every Monday to discuss a number of measures, as well as hear recommendations from the Chief Medical Officer and the Ministry of Health. So these are discussions that are ongoing. They happen very, very regularly and fulfill a large portion of our time, but we continue to have these discussions.
Thank you, Minister. That we're actually at the end of our press conference. I'm just going to allow each of you to have a few minutes if you want to say anything in parting.
Thank you, honey, and thank you to members of the press for their questions. I again wish to implore the people of Bermuda to continue with the public health guidelines. We are doing really well as it relates to our levels of immunization. However, we do know that the Omicron variant is highly transmissible, and I would encourage people to follow the public health guidelines. I also would like to just re-emphasize the fact that the testing strategy that has been adopted by Bermuda almost 2 years ago will continue. We are one of the highest ranking countries that perform testing, and we will continue to operate a testing strategy and a seamless transition with respect to MDL. And I can assure members of the public that that is our ultimate objective. Thank you.
Thank you, Minister. And I'll certainly echo the words and the concern and the great support that we have seen from public health and the Ministry of Health and so many other individuals and groups within the private sector that have contributed in many different ways. I'd certainly like to remind the public and to reassure them that we are open for business, and we expected that there would be challenges, and there are, but we at this point in time would not want anyone to stay away from the hospital believing that they would be at serious risk of getting COVID, or thinking that we will not be able to offer the treatment that they need. So if there's illness, come or call. We're happy to treat you. We're prepared. We're open for business. And to our many staff members who have been doing a sterling job, and for those in certain departments where due to a shortage of staff, they have had to be working extra hard, we wish to thank you and to make it known that your work and effort is appreciated. Thanks.
Thank you. I just want to add that we remain in very fluid times and that things are changing quickly. So government, we are committed to continue to review our COVID protocols as well as our COVID procedures, and we are always remain open to collaboration Our goal for the Department of Education has always been to maintain in-person learning and to also make sure that our COVID-19 safety protocols and measures are in place. And we want our staff, students, parents to continue to stay safe as best as we can. And we look forward to the rollout of the and your support and everyone's support as we move forward with the at-home antigen testing program. Thank you.
Thank you, Minister Wilson, Minister Furbert, Dr. Miller. That concludes our press conference today.